respond, sick woman.
A radio dispatcher calls Engine Company 10 into action. Washington, D.C. firefighter and paramedic John Botwin is on the ready.
To be good at this job, you have to be able to handle every situation.
At the scene, John isn't fighting a fire, but helping people who need medical care.
You're the front lines of every aspect of health care and people care. I mean, we do it all.
Firefighters with Engine Company 10 are trained emergency medical technicians, and they're increasingly being called on to also be primary care providers. The firefighters arrive on the scene quickly and offer medical help until an ambulance arrives minutes later. In large cities like Washington, to ensure the fastest response to medical calls, fire departments dispatch trucks carrying a paramedic and firefighters. Engine Company 10 is located in Trinidad, a neighborhood plagued by poverty and crime. Many of its residents don't have health insurance, and there are few doctors or clinics available. When people need medical attention, they phone the emergency number 911.
It's another emergency response call for the crew from Engine Company 10. As a matter of fact, this is one of the busiest fire stations in the country, and 80% of those calls were for medical emergencies.
How are you?
Okay.
What's going on today?
30-year-old firefighter John Botwin responds to a report of a 12-year-old combative patient. John uses his counseling skills to help a girl who has run away from home.
Every day, I got to pick people off the street that are alcoholics, drug dealers. You know, they've gotten themselves into prostitution. If you get messed up on the wrong crowd and you get in these streets, you're going to have a very short life.
Within the next hour, John treats a patient for an asthma attack and arranges transportation to the hospital emergency room for someone complaining of chest and stomach pains. John sees many of the same people again and again.
An ER is not a primary care facility. That's not a doctor. You know, but if you don't have to pay for the extra cost in going to an ER, then what do you really care what it costs? And those people are taxing and troubling the healthcare system.
As day turns to night, Engine Company 10 responds to more medical calls. Firefighter and paramedic Kiana Lofton is going to help an elderly woman with an upset stomach. 10 other firefighters and paramedics responded to this call. Kiana tries to educate patients on their treatment options. It can cost about $3,000 to run a truck and 4 firefighters to medical emergencies in a 24-hour period. The expense has led some to question the cost-effectiveness of sending fire trucks to medical emergencies. Sergeant Jonathan Johnson, a 9-year veteran of the fire department, says medical calls are putting a burden on the system.
It's kind of sad. It overwhelms the system at times.
Washington, D.C.'s fire department is trying to identify people who abuse the emergency response system and find other ways to get them health checkups and the proper medication. Members of Engine Company 10 hope the plan can take hold so they won't be called on so often to serve as primary health care providers. Chris Simkins, VOA TV, Washington.